Assessment of gait and balance is crucial for diagnosing various neurological conditions. While observing gait, physicians must focus on observing gait patterns, balance, and coordination. Differentiating between sensory and cerebellar ataxia is essential. Sensory ataxia presents with a high-stepping gait and worsens with eyes closed, while cerebellar ataxia shows a wide-based, unsteady gait regardless of visual input. The Romberg test helps distinguish these types. A positive Romberg sign, loss of balance with eyes closed, indicates sensory ataxia. Mastery of these assessments aids in accurate diagnosis and effective patient management.
First of all, make your patient stand up and notice that he can balance himself. Perform the Romberg test, asking the patient to sit with the feet as close to each other. Notice he sways to side. Ask him to close the eyes so that you take away the sensory component. And if he doesn't sway, then ask him to walk straight. Notice the stance, balance, any wide waist gait, any swaying or any waddling gait. Then watch for the tandem walk, which is performing walking on a straight line with feet approximate to each other. And this actually checks both the balance as well as the gait. Now, the different kinds of gait abnormality which you can notice, the first of all is gait apraxia. Apraxia actually means that loss of performance of a learned motor activities. So once you are learned to walk since your childhood, so as you grow, this walking say is known and you can perform it easily. But if there is no apparent motor weakness or any balance abnormality, if you still patient can't still walk, it's would be called as gait apraxia, and it's a dysfunction of a parietal lobe. Parkinsonism gait is classical fascinating gait with the short stepping gait, and the patient will stoop forward. Spastic paraparesis is there's a increased tone the adductors of the thighs, and this leads to a scissoring gait. A myopathic gait is a waddling type of gait, like the waddle of the duck. The patient with the foot drop would walk with the stepping gait, that he would lift the foot up and then push it forcefully on, because he is not aware that his foot has cleared the ground or not. Monoplegia spastic would be the hemiplegic gait, like circumduction and then tilting the weight to one the normal limb, and then rotatory movement of the paretic side. Ataxic gait would be like a drunken gait. A patient with a sensory ataxia would be able to balance himself with eyes open, but would not be able to balance himself with eyes closed when the sensory component of where the body parts are is taken away. And this is exactly what the Romberg signs is performed for, or which tells us.
The assessment of gait is crucial in diagnosing various neurological conditions. Differentiating cerebellar from sensory ataxia is essential. Cerebellar ataxia is characterized by unsteady, wide-based gait, dysmetria, and intention tremor, while sensory ataxia presents with a high-stepping gait, positive Romberg sign, and worsens with eyes closed. Neurological diseases exhibit distinct gait patterns. Hemiplegic gait, often seen in stroke, involves circumduction of the affected leg. Spastic paraplegia, common in cerebral palsy, results in a scissoring gait due to tight hip adductors. Subacute combined degeneration of the cord, linked to vitamin B12 deficiency, leads to a broad-based, unsteady gait. Parkinsonism is marked by a shuffling gait, reduced arm swing, and difficulty initiating movement. Recognizing these patterns aids in accurate diagnosis and management of underlying conditions.